Hello everyone, I'm Dr. James, and welcome to JointWise Health. This is where we share reliable medical knowledge and practical advice to help middle-aged and older adults live healthier and happier every day. If you find today's content helpful, don't forget to hit like and subscribe, so together we can overcome the health challenge called gout. Today, we're diving deep into current treatments for gout. I want to be clear. Gout isn't just a short-term flare-up that goes away on its own. If left untreated, it can deform your joints, cause unsightly tophi lumps under the skin, and even lead to serious kidney damage. On the other hand, if we understand the condition and apply the right treatments, gout can absolutely be managed, allowing patients to maintain an active life with less pain and more confidence. So, where do we start? First, it's important to understand that gout treatment falls into two main categories: treating acute gout attacks and long-term management to prevent future flare-ups. This approach forms the foundation of modern medical guidelines, from the American College of Rheumatology, ACR, to global health experts. Think of a gout attack like a sudden fire breaking out in your home. When the flames rise, your first priority is to put them out fast. In gout, those flames are the intense inflammation inside the joint, causing pain, swelling, heat, and redness. During this stage, doctors usually recommend a few key groups of medications. 1. Non-steroidal anti-inflammatory drugs, NSAIDs. These are the first-line choice. Common names include ibuprofen, Advil, Motrin, and naproxen, Aleve. They quickly reduce inflammation and relieve pain. But for older adults or those with heart disease, kidney problems, or stomach ulcers, NSAIDs can carry risks, so they're not safe for everyone. 2. Colchicine. This is the old friend of gout treatment, used for centuries. It works best when taken early, right at the start of an attack. However, side effects like diarrhea and nausea can be bothersome. At lower doses, though, it's usually safer for older adults. 3. Corticosteroids. If NSAIDs or colchicine aren't suitable, doctors may turn to this group. Options include oral prednisone or injections directly into the inflamed joint. Steroids work quickly, but long-term use can cause serious side effects, from osteoporosis to high blood sugar. That's why corticosteroids are typically short-term solutions. And here's something I always emphasize: never self-medicate with leftover prescriptions without checking with your doctor. Many of my patients thought, I'll just take the same pills I used last time, not realizing that their health status may have changed, especially in their 50s and 60s. Beyond medication, some simple steps can help during a gout flare: rest the affected joint, apply an ice pack for 20 minutes at a time, and elevate the foot to reduce swelling. It may sound basic, but many patients tell me that just using ice brings noticeable relief. But here's the mistake I see all too often: once the pain subsides, people sigh with relief and stop all treatment. That's the biggest error. Remember, gout doesn't disappear just because the pain is gone. Uric acid is still elevated, and those sharp crystals are still silently building up in your joints and kidneys. Long-term gout treatment is like removing the source of the fire, not just putting out the flames. The main goal here is to lower uric acid levels in the blood to a safe range, usually below 6 mg per deciliter, or even lower for those who already have complications. The main groups of medications include: 1. Allopurinol. This is the most commonly prescribed medication. It works by reducing the body's production of uric acid. Allopurinol is considered the gold standard for preventing gout flare-ups. However, treatment should always start with a low dose and gradually increase, especially in older adults, to avoid rare but serious side effects. 2. Febuxostat. An alternative for patients who can't tolerate allopurinol. However, recent studies suggest that febuxostat may increase the risk of heart disease, so close monitoring is required. 3. Probenecid. This drug helps the kidneys eliminate uric acid more effectively. But it's not suitable for people with kidney disease or a history of kidney stones. 4. Pegloticase. A biologic therapy, usually reserved for severe or treatment-resistant cases. Pegloticase can rapidly dissolve uric acid crystals, but it's expensive and typically given only in hospital settings. Here's something interesting I want to share. Many of my patients were initially afraid of having to take medication for life. But once they maintained stable uric acid levels, they realized how positively their lives had changed: fewer painful flares, better sleep, and most importantly, freedom from the constant fear of another gout attack striking tonight. When we understand the two pillars of gout treatment, first, stopping acute attacks, and second, long-term uric acid control, the most common question my patients ask is, so how do I know which treatment is right for me? Which medication, what dose, and will I need it for life? This is where personalized treatment becomes essential. No two gout patients are exactly alike. I've seen men in their 60s who only experience 1 or 2 mild attacks a year, with uric acid not too high and joints still intact. But I've also treated patients as young as 45 who required multiple hospitalizations due to severe pain, swollen and deformed joints, and even kidney damage. That's why the treatment plan always depends on several factors. 1. Frequency of gout flares. If you only have an occasional mild attack, your doctor may suggest managing pain is needed. But if you have 2 or more attacks a year, or if complications develop, then long-term uric acid lowering therapy becomes almost mandatory. 2. Blood uric acid level. This is a key indicator. Patients with uric acid levels above 9 mg per deciliter are usually advised to start uric acid lowering treatment, even if symptoms are mild, because the risk of kidney and joint damage in the future is very high. 3. Overall health condition. Older adults often have other health issues such as high blood pressure, diabetes, kidney disease, or heart problems. These conditions play a big role in deciding which medication is safest. For example, a patient with chronic kidney disease may not be a good candidate for probenecid, but could still take allopurinol at a very carefully adjusted dose. 4. Age and lifestyle. Many seniors are already on multiple medications, so doctors have to carefully watch for drug interactions. One thing I always remind my patients is this: uric acid lowering therapy takes time, and sometimes, in the first few months, gout flares can actually become more frequent. Sounds counterintuitive, doesn't it? Patients often say, "Doctor, I started taking uric acid lowering medication, but why am I getting even more flare-ups?" The reason is that as uric acid levels in the blood drop, crystals that have built up in the joints for years begin to dissolve. This can trigger the immune system to react, causing more inflammation. But this is only a temporary phase. Over the long run, those crystals will disappear, and the flares will decrease. To ease this transition, doctors usually prescribe a low dose of colchicine or a mild NSAID during the first few months. I often compare it to cleaning out a dusty storage room. At first, the dust makes you cough and feel uncomfortable, but once the cleaning is done, the room becomes clear and fresh. In the last decade, gout treatment has advanced significantly. Here are a few highlights. 1. Biologic therapies. As I mentioned earlier, pegloticase is one of the most advanced options. It's an intravenous enzyme that breaks down uric acid into a form the body can easily eliminate. It's highly effective for patients with severe, treatment-resistant gout. But the high cost and risk of immune reactions remain big challenges. 2. Targeted anti-inflammatory therapies, IL-1 inhibitors. New medications are being studied that directly block the inflammation triggered by uric acid crystals. While not yet widely available, these treatments could become an important option in the future, offering faster pain relief with fewer side effects. 3. Genetics-based personalization. Some people, especially those of Asian or African descent, have a higher risk of severe allergic reactions to allopurinol. Today, genetic testing can help identify this risk ahead of time, allowing doctors to choose safer alternatives. These advances show us that gout treatment is no longer old-fashioned. We now have more and better options, tailored to each patient's needs. Let me share a story. Mr. Sam, a 68-year-old from Texas, came to see me 2 years ago. He had been struggling with gout for nearly 20 years and admitted, "I only took painkillers when I needed them." The result? His big toe joint had become deformed, and tophi lumps were forming on his elbows. At first, he was very hesitant about starting daily uric acid lowering therapy. But after we discussed it thoroughly, started him on a gradual dose of allopurinol, and monitored his blood tests regularly, something remarkable happened. After 1 year, his uric acid dropped to 5.5 milligrams per deciliter. More importantly, he had no gout flares for 12 straight months, and his tophi started shrinking. Mr. Sam told me, "My only regret is not starting treatment sooner. I lost so many years of comfortable living just because I was afraid of the medicine." His story is not unique. It reflects the experience of millions of patients. And it reminds us that gout treatment isn't about enduring, it's about regaining freedom in life. One point I want to emphasize, especially to sons, daughters, and grandchildren caring for older relatives with gout, is how important family support is. Many older patients forget their medication, or avoid follow-up visits. But sometimes, a simple reminder, or accompanying them to the doctor's office, can make all the difference in keeping them on track. I've seen patients improve dramatically just because they had a loved one by their side encouraging them. Treating gout isn't only about taking the right pills. It's about helping patients live fully, walking without pain, playing with grandchildren, enjoying picnics or family gatherings without the constant fear of, "Will gout strike again tonight?" To achieve that, we need a comprehensive strategy, medications, regular monitoring, and strong family support. That's why I always say, gout is not a life sentence. It's a condition that can absolutely be controlled, as long as we follow the right path. And when we talk about choosing the right treatment, many people assume, as long as I take the medication, I'll be cured. But the truth is, gout isn't a disease you can erase with just a few weeks of pills. It's more like an unwelcome companion that follows you around. The only way to live comfortably is to manage it consistently, monitor it regularly, and make timely adjustments along the way. So how do we actually make this work, especially for middle-aged and older adults in the US, who are often already on multiple medications and managing several health conditions at once? One of the most common mistakes I see is this: patients take their medication for a while, feel better, and then stop follow-up. They think, "I'm fine now, I don't need to check anymore." But gout is a silent disease. Uric acid levels can creep back up without causing obvious symptoms until the joints or kidneys are already badly damaged. That's why experts recommend 1. Regular blood tests. At least every 2 to 3 months in the early stages of uric acid lowering therapy, then every 6 to 12 months once levels are stable. 2. Monitoring kidney and liver function. Because many gout medications are processed through these organs. 3. Clinical checkups. Doctors will examine your joints, check for tophi, and ask about flare frequency. I often tell my patients, blood tests are like checking the fuel gauge when you drive. You can't just keep driving without knowing how much gas is left, right? Another point many people don't realize is that gout medication doses are not one-size-fits-all. Some patients do well with just 100 milligrams of allopurinol per day, while others may need 300 to 400 milligrams to reach target uric acid levels. Especially in older adults, doctors usually start low to minimize side effects, then slowly increase the dose step by step. This process requires patience and teamwork between doctor and patient. I'll never forget one case, Mrs. Linda, a 72-year-old with gout and chronic kidney disease. She started with allopurinol 100 milligrams per day, but her uric acid barely budged. After months of careful follow-up, we gradually adjusted her dose up to 250 milligrams per day, and only then did she finally reach the target of under 6 milligrams per deciliter. If she had given up early, gout would have continued to trouble her for years. One big reason people stop treatment midway is side effects. With NSAIDs, it may be stomach pain. With colchicine, diarrhea. With allopurinol, sometimes skin rashes. I always advise my patients, never suffer in silence. If you experience side effects, tell your doctor right away. In many cases, it's as simple as switching to another medication or adjusting the dose. For example, one of my patients developed a rash while on allopurinol. Instead of stopping treatment altogether, we ran an HLA-B*5801 genetic test to rule out a severe allergic reaction. Then we switched him to febuxostat, and the results were excellent. The key message is, there are alternatives as long as you don't give up. Gout treatment also can't be separated from other health conditions. Most middle-aged and older patients in the U.S. have at least one of the following: high blood pressure, type 2 diabetes, obesity, chronic kidney disease, heart disease. These conditions not only contribute to high uric acid but are also affected by gout medications. For example, a patient with diabetes should avoid long-term corticosteroids, since they raise blood sugar. A patient with kidney disease needs careful dose adjustments of allopurinol and cannot take probenecid. A patient with high blood pressure must be cautious with NSAIDs, which can raise blood pressure even further. I often explain to my patients that we're not just treating gout, we're treating the whole person. That's why every treatment plan has to be tailor-made. Even though today we're focusing on treatment and prevention, I need to emphasize one important point: medications work best when combined with lifestyle changes. This doesn't mean I'll go deep into diet or exercise right now, because those are separate topics that our channel, JointWise Health, has covered and will continue to cover in other videos. But what I want to stress here is, no pill can completely make up for an unhealthy lifestyle. I've seen patients who rely only on medication without making any changes, and their gout attacks keep coming back. On the other hand, those who stick with both medication and healthy lifestyle habits improve much faster, stay stable longer, and often need lower doses of medicine. If you'd like to learn more about diet and daily habits that help manage gout, I encourage you to check out the specialized videos we've made. There's also another factor that's rarely discussed but incredibly important: the patient's mindset. I've met patients who feel hopeless about taking medication for life. They're afraid of dependence, side effects, and the idea that they'll never be cured. But once we talk it through, and I explain that the goal isn't about taking pills forever, but about living a life with less pain and better quality, their perspective begins to shift. Some patients even tell me that successfully managing gout has boosted their confidence, made them happier, and even improved their family relationships. So here's what I want to leave with you: treating gout is not just a medical journey, it's also an emotional one. Consistency, family encouragement, and the belief that you can live well with this condition are just as important as the daily pill. And if you're a son, daughter, or caregiver of someone with gout, remember, your patience and support are a form of medicine no pharmacy can provide. A simple, "Mom, did you take your medication today?" or "Dad, let's go for your checkup next week," can make a huge difference. We've come a long way together, from those sharp, sudden gout attacks at night, to calming down flare-ups, to understanding long-term uric acid control, monitoring, adjusting, and staying consistent. Now, let's put it all into one bigger picture: how to turn gout treatment from a burden into a path toward healthy living. One of the biggest fears I hear from patients is, "Am I going to suffer from this forever?" The truth is different. Yes, gout is a chronic disease. Yes, you need medication and long-term monitoring. But forever does not mean forever in pain. Effective gout treatment can give you a life without pain, without the constant worry of sudden attacks, and without joint deformities. Treatment doesn't take away your freedom, it actually gives it back, freedom that gout had stolen. I remember one of my patients, George, age 74. He once told me, "Doctor, I used to think getting old meant I just had to live with pain. But now, thanks to treatment, I can go fishing with my friends, play ball with my grandson, and most importantly, I don't have to turn down invitations because of my health anymore." That's the message I want to share: gout can be managed, and successful management can open the door to a much better life. If I had to summarize everything about gout treatment into just 4 words, they would be patience and persistence. Patience, because results don't come overnight. The first few months might still bring pain and frustration. But if you trust the process and stay the course, change will happen. Persistence, because gout will come back the moment you let your guard down. Taking your medication regularly, going to checkups, and monitoring lab tests, these are the foundations of control. Combine both, along with the support of your doctor and family, and you can turn gout from a lifelong fear into a condition that stays quietly under control. Still, even with the right treatment plan, there are times when you or your loved one should call the doctor immediately. For example, if a gout attack is much more severe than usual, or if it doesn't respond to the medications that normally work. You might notice unusual swelling, warmth, or redness in a joint, and sometimes, that's not gout at all, but a joint infection, which can be very dangerous. If you experience rash, difficulty breathing, or swelling of the lips or tongue while taking gout medication, that could be an allergic reaction. Or if you notice signs of kidney problems, like reduced urination, swelling in your legs, or back pain, it's important to seek medical help. I'm not saying this to make you anxious, but to reassure you, knowing when to ask for help is an important part of living safely with gout. One very special thing I've observed in gout patients is that many feel lonely. Quite a few have told me, "I don't want to tell anyone because I'm afraid they'll think I'm weak." But when they join support groups or patient communities, they realize that millions of others are going through the same struggles. Here in the US, there are many organizations and online forums where gout patients and caregivers can share experiences, exchange tips, and support one another. I encourage you to connect with those communities, because sometimes, a word from someone in the same boat can be more powerful than even a doctor's advice. And if you're watching this video not for yourself, but because your parent, spouse, or friend is living with gout, I want to say thank you. Your care and companionship are truly priceless. Gout doesn't just hurt the joints, it also affects the mind and spirit. With family support, patients are more likely to stick with their medications, keep up with appointments, and believe that they are not alone in this journey. Even a small action, reminding them to take their pills, accompanying them to a doctor's visit, or simply listening when they talk about their pain, can make a huge difference. Try looking at gout from another perspective. Yes, it's a chronic disease. But it's also a reminder for us to take better care of our overall health, from nutrition and exercise habits to regular checkups. Many of my patients have told me that once they started managing their gout, their blood pressure improved, their weight dropped, their blood sugar stabilized, and they actually felt healthier than before. So gout is not the end of the road, it can be the turning point toward a more intentional, healthier lifestyle. If you're still with me at this point in the video, I know you or your loved one truly care about managing gout seriously. So please, keep these key points in mind. Gout can be controlled with the right medication and consistent monitoring. Don't give up just because flare-ups still happen in the beginning. Always work closely with your doctor, and never hesitate to share side effects or challenges. Patience and persistence will bring long-term success. And if you'd like to learn more about diet, lifestyle, or practical tips to lower your risk of gout attacks, be sure to check out our other videos here at JointWise Health. We've prepared plenty of helpful content to walk alongside you in this journey. Before we finish, I want to leave you with one message. Small daily changes can create a big difference in your life. Whether it's taking your medication on time, getting your labs checked regularly, or simply drinking an extra glass of water, all of these steps bring you closer to a healthier, less painful life. Remember, you are not alone on this path. You have your doctors, your family, your community, and channels like JointWise Health here to support you. If you found this video helpful, please like, subscribe, and share it with loved ones who may need this information. And I'd love to hear your thoughts, stories, or experiences in the comments below. Your words might inspire and encourage someone else. Wishing you health, happiness, and joy in every stage of life.